I'm pleased to be joined today on Health Beat by Dr. Michael Woodbury, an orthopedic surgeon with Faith Regional Physician Services Orthopedics in Norfolk, and we're talking about joint replacement. So Dr. Woodbury, what are some things that someone can do now to possibly avoid having a joint replacement in the future?
Well, generally speaking, the number one thing is just stay active. The American Academy of Orthopedic Surgeons always recommends anybody who has arthritis to stay active with exercise, low impact exercise. So no long distance running, but certainly walking is very healthy for the joints. Some resistance exercises is good for the joints. Also, tennis, people who golf, all these are encouraged. That's one thing people can do to maintain their joint, because as they maintain that muscle tone, they make the joint very stable, makes it very strong, and you're not susceptible to more laxity in the knee or the hip, which can lead to more arthritis. There are genetic factors that patients should be checked for. One is if you have a family member with rheumatoid arthritis or some sort of an inflammatory arthritis. If you get on early medications with your primary doctor or a rheumatologist, those can help preserve your joints for many, many years. It really has changed the way arthritis has developed with rheumatoid and all that types of diseases over a long period of time. Eating a good healthy diet and weight loss is always a good thing to try if you're having joint pain and you want to prevent a surgery. With weight loss, every time you lose 5 pounds, you decrease the contact stresses on the joint, which allows it to feel better and not as painful. The other thing is if you want to avoid surgery but you're having knee pain, injections can help with cortisone, or there's viscosupplementation, people call it like rooster comb injections, to help with lubricating the joint and helping it to prevent more pain and inflammation at a later point.
I see. Interesting. Well, thank you very much. We appreciate
You're welcome.
knowing that. To learn more about clinic locations, specialties, and providers, visit frpsclinics.org.